Good morning, Swati. I hope that's how you pronounce your name. Welcome to our webinar, and we will be starting at 10 o'clock. And you're welcome to join in on this conversation. We do usually have a little bit of a chat about what's going on in the world. So if you want to, yes, hello then.
Hi there.
Hi. How are you today?
I'm doing fine. I'm in the West Pacific time, so just kind of woke up, got my tea, yeah.
Oh, thank you for joining early. We realized afterwards we started it at 10. That meant if anybody wanted to come from Vancouver, that area, it would be like very early. So what part of the West are you in?
I am, I'm in the Bay Area, which is the San Jose, Sunnyvale side.
So you're in the US?
Yes.
Well, welcome and thank you. I hope you get some insights. How does it feel down there in the United States in terms of COVID?
I think this is an actual sense a pandemic. So yeah, I don't think there's any difference. And we haven't really gone back in, but we're talking about going back to work now. So we're setting up protocols on how to do that. And that's where, so I had an employee call in, she was crying on the phone. She's so scared to go back to work. She's, she has some underlying conditions. So it's very hard. So it's more of the physical safety and a mental safety.
Oh yeah, they're equally important, if not a mental, even more important, right?
Yeah, and we don't feel it slowing down right now. So it's pretty, the place where we are, it's a little better, but overall it's like 2,000 plus deaths every day.
Oh my God!
I think that's a lot. So, but we can't I don't think we can be under lockdown for longer because of other reasons that also run equally. So it's just a very hard. It's going to be a hard transition back to work. And yeah, is it similar at your area too?
Mm-hmm. Diane, would you want to share that conversation that you and Jenny had just before I came on? I found that interesting.
With regards to, this was just regarding
an 88-year-old said I can't live this way anymore or something.
Well, it was a doctor they were interviewing on our national broadcaster this morning. It's Doctor's Day. I don't know if it's international, but it is here in Canada anyway. And she was talking about the fact that she's changed her perspective about when first COVID happened and she was going to have to be on the front lines. She decided she was going to remove herself from her family, live separately because she was afraid of bringing things back to home. And then the demand, fortunately here in Toronto, we haven't been overwhelmed in terms of our hospital sector. So the work that we've done with regards to physical distancing has worked. We've not had an inundation in terms of overwhelming our healthcare system. And so now she's changed her perspective in terms of that she knows that she's confident with the measures that they're taking to protect themselves, that they have enough personal protective equipment available to be able to do that, which also helps. And she realized that COVID's not going to go away. So she can't stay away from her family forever. So now she's gone back home. She's put in place ways and means of being able to make sure that she's still protecting her family, but saying that, her perspective is now we have to live with COVID because it's not going to go away. We don't have a vaccine. And so now our perspective has to be, how do we get on with our life with COVID and incorporate that? So it was really quite interesting to listen to her.
Yeah, no, my daughter was telling me she likes to study, she has biology as a subject, but she had gone into a little more research, and she was telling me how global warming kind of changed the habitats of bats, which is the main cause of this virus, where we get coronavirus from. So because of, according to her, I don't know how much fact or this thing is, she said that as there is more global warming and as there is more changes in all around the ecosystem, this COVID is one virus. We might be seeing more viruses in the future. So even if, it's like we have to be very careful in how we live and how we protect the earth. So it has a very deep, bigger meaning also. So I just feel like right now we're just coping from day to day or hour to hour sometimes, but I think in a bigger picture, I hope we understand what started it and what caused it. So that this is definitely devastating to have a life like this and accept it as a norm, which it is right now, a new norm. So it is very overwhelming sometimes.
Yeah, I think we adopted this. Violet, we're just having a conversation waiting for other people to come on, so please unmute yourself and join in. But I think we've decided in this particular situation, we're going to protect ourselves, right? Whereas when SARS came, we didn't do this measure. We allowed those that would get sick, and we would build immunity. But this one, we protected everybody. And now we're thinking, okay, how long can this last? And when they talk about 18 to 24 months before we have a vaccine, what happens? But I think the symptoms are so unpredictable and scary. This is why they've decided to do this versus, any other past ones. Violet, you've unmuted, so please feel free to share your thoughts.
Oh, hi. Nice to see you again, Hilda. How have you been?
Hi.
Yeah, so I feel like this has just really transformed the way that we work remotely. I mean, it's an unusual circumstance, and it's really kind of catapulted us into the future of remote work and accepting the new reality that way, and that people really can be productive during their work at home time. Probably more productive if they didn't have children at home and that sort of thing running around. But I'm very hopeful for the future of HR as a profession that will be seen more as essential. I have heard a lot of businesses scrambling for HR support after COVID. Do I lay people off? What is a constructive dismissal? What risks am I facing? How do I get these people to work remotely? And how do I stay engaged with my team? So I think it's just really transformed the way we're working, and also it's a great opportunity to improve. So things that we wanted to change before but never had the time to. I watched a really great webinar yesterday on retain and gain. How do we retain our employees through this? How do we help them with their career development and make them feel appreciated? So we have an opportunity to step back, to assess. And then when things do slowly open up again, I'm quite hopeful that the workplace will be a better place for everybody. So.
Mm-hmm. And that's sort of why I do these webinars, because I think there are so many people, business owners and decision makers, who all of a sudden are faced with key decisions from a human resources perspective that they never thought they would have to do, and never thought they'd have to do in like 7 weeks. Because you can pick and choose some transformations, but this was all thrust upon us, and whether it's in human resources or finance or even like learning how to do homeschooling. All of a sudden people are now experts at homeschooling. So we've been transforming every profession, every part of our individual lives. So I kind of opened it up while we were waiting for people. It is 2 minutes after 10. So welcome everybody to our webinar series, tough COVID-19 tough decisions for business owners. And this is episode 12. So today we've got I think a nice sized group, and we really want to dive in and talk about the case studies of those difficult conversations. We actually had our difficult conversations on Wednesday, where I gave information and some anecdotes or individual situations that I found to help support some of the strategies. But today I would like to focus on case studies, and we'll have a dialogue. So I'd like to open it up for discussion at the end. So I'm going to start, and I'm going to share my screen with you guys. Okay. So as I said, Welcome to COVID-19, Tough Decisions for Business Owners. This is episode 12, How to Master Difficult Conversations at Work. And we're going to include some case studies today. We started this webinar series 6 weeks ago, and in Canada, in Ontario, we were told 7 weeks ago that we were now in a state of emergency and we were required to only have essential services, and a lot of companies started to work remotely. We decided we wanted to start a webinar series to answer needs, to help managers, business owners, and decision makers, to provide them with tips and strategies to help them through the tough decisions. We were talking just before the start of the presentation about how COVID-19 has transformed the world globally. Things we didn't think we could do, we're now doing. A lot of us are working remotely from home. Essential workers now are people on the front lines of healthcare and even front lines of pharmacies and retail, pharmacies and grocery stores, and even those people that are delivering food to us. We have now done things we didn't think we could do. Rules we couldn't break are now broken. If you're interested and you want to tag us, we have tags for our different social media at PeopleBright, or tag us at hashtag COVID-19 TDBO, Tough Decisions for Business Owners. So as we're starting today, I wanted to share with you that if you have any things that you want to chat, you want to give some examples as I'm talking, please use the chat. If this is your first time on Zoom, I think most of us are getting pretty good at it. At the bottom or the top of your screen, there'll be a bar, and you can see the word chat. And I encourage you to have chats about what you're hearing and give anecdotes. If you'd like to save it, there's a little 3 dots where the icon chat is, and if you push that, you can actually save the chat. Click on Save Chat and you will save it, and as you update the saving, it will continue to save on that one file. If you don't want to put in the chat to see everybody, do send your chat privately to Jenny Ho. Jenny Ho and Diane Matthew are here with me, and they're supporting me through the presentation today. So we do plan this presentation for 45 minutes. I hope to get to the case studies about the 25-30 minute mark, so we'll have some healthy discussion. I'd like to open it up for that dialogue, because I think in dialoguing, we really get to the bottom of how will we deal with difficult conversations. A little bit about myself. I am the founder and president of PeopleBright Consulting. I really want to help companies be the best version of themselves, and that's through understanding that people are their greatest asset. I am a creator of a concept called Connect with Rev Up, and I'm an award-winning work culture specialist. My husband and I had our own engineering firm, iTrans, and we grew it from 2 to 125 people in 7 offices across Canada. So I know where businesses have gone from the startup phase to really developing a robust organization where people expect it to be very professional and have all the bells and whistles that you need in a human resources and company in general. So we actually felt we were a unique company that really challenged the staff in a positive way to really embrace their careers and to make the most of what they wanted to become. And we also wanted to make the work culture a place where people felt valued and respected. So we put our names out there, and we became recognized as best workplaces in Canada, top 10 twice. So as a result, my passion is people, and I founded PeopleBright Consulting. I do have a background that includes working in healthcare, in human resources, in engineering, professional services, IT, and not-for-profit. So we're going to cover today an update of relevant legislation for businesses. I'm going to keep it very high level because I really want to dig down and talk more on those tough decision conversations that you're going to have. The second thing is just understanding the nature of difficult conversations. I want to give you some interesting stats, which, as I'm doing my research to validate my gut responses on difficult conversations, these were eye-openers. And I think it validates why we want to get comfortable in those difficult conversations. I want to talk about the impact then of avoiding difficult conversations. And I've got some actual surprising numbers that are going to make you say, I should get better at feeling good about doing difficult conversations and getting comfortable with it. Provide you later then with tips and strategies and the value of listening, and a bit of a highlight of the concept that I have of Connect with Rev Up and the value of a tool that I use called Fascination Advantage. Then we'll get into case studies. And I thought we'll focus just on one case study because from it, there are various scenarios. So think about it now as we're going to get prepared to talk about it. We're going to talk about somebody who gets laid off and then the recall to work. And that's a scenario, but it has many options. So I think you'll find this particular example an interesting one for us to talk about. And last, how we can help you to continue to move forward with COVID-19. This is a slide that I prepared and we keep updating it. And in blue are the highlights of some of the key things that have evolved over the last couple of weeks. And I think the ones I want to point out at the bottom there is the new 2,500 wage boost for low-paying essential workers. So they recognize some of our frontline people, like those in long-term care, and even those people who are in the grocery stores doing our cash, are not making enough. And so the government in Ontario and Canada want to boost that up to make sure that people get a minimum of $2,500 in wages. And the last thing is that in Canada, the provinces are slowly talking about recovery. Some are slower than others and some are fast. In Quebec, they actually have identified plans and a laid out plan to start on May 4th, where things will open up. And by May long weekend, the golf courses are going to open up. So that's what they're talking. In Ontario, where I'm from, they're talking about a plan that's very generic right now, preparing us that it's coming, and dates will follow when certain criteria are met, and that is the number of cases are continuing to go down. This is for references for those that you are listening, and you'll get slides later for this, and you can digest this at your leisure. So I want to get into difficult conversations. Why do people hate having difficult conversations? It's something that we tend to avoid, and maybe understanding why will help us say, okay, I understand why, let me do something about it. So why do people do that? Well, I think we're emotional people, not emotional, but we are social people, and we really don't want to hurt people's feelings. We really don't want to hurt people's feelings. So that's one reason. And usually when you have a difficult conversation where you know there's going to be emotions involved, this is why you do procrastinate or avoid it. You're afraid of hurting people's feelings. You're afraid of what somebody's going to say, or you're afraid of what they won't say. What if they just sit there and they don't say anything? What if they cry? So these are the kinds of things people are worried about. And when a person responds, you're not sure what you should do. So there's that awkwardness, there's the lack of confidence in knowing what to say when you feel you're going to have a difficult conversation. So this is an interesting study. It actually came out of the UK in 2015. And they said, what are the top 10 reasons, or what are the top most difficult conversations you feel you would have? And these are not just about work, they're about anything. So you can see, and the study said, this is very interesting, the top 3 reasons are work related. You would rather talk about breaking up with somebody than ask for a raise, or talk about somebody's inappropriate behavior at work, or talk to somebody about their lack of good work performance. Top 3 reasons. And the 4th one is promotion. And after that, you have things like sex, breakups, family relationships, money, health, and letting go of somebody, terminating is still in the top 10, but down there. So these are some of those that were identified in the UK. Another study, another finding from that was that they said that more than 50 workers, now these are not managers, these are everybody in employment, deal with a difficult conversation at least once a month. And it also went on to say that a lot of managers lack training to deal with difficult work-based conversations. Over the last decade, the UK has felt the budget pinch. So, of course, training is the first thing to go. So a lot of managers, particularly middle managers, lack the training to really handle those difficult conversations, to feel the confidence. And in fact, 61% of the people said that they lack the confidence and they really wish they had more confidence. Another study that I found, this one was based in Utah, where they looked at 1,000 people, said the finding was 72% of people fail to speak up when peers do not pull their weight. And I think we're all guilty of that. We sort of say, oh, you know, Sally's not pulling her weight. What do we, you know, but you talk about it around the water cooler and nobody goes to management or nobody addresses it. 68% fail to report disrespect. So when you have people that are disrespectful of others, people just turn the other way and they don't say anything that is meaningful to get things done. 57% overlook failure of important work. So if you feel that the project's going south and you don't know exactly what to do, you don't say anything. You just, you know, 57% of people will not say something if they feel it's wrong. So what does that mean from a cost perspective? It's estimated that $7,500 is the average amount that's is lost in terms of not having those conversations. And 20% of the people estimate that the cost of $50,000 is for their inability to speak up. Now, I didn't say over what period of time, but that's a lot of money. If people think that they're impacting on a company by that much, imagine what could be saved if people had the confidence or people had some training to deal with conversations that are difficult. And then another interesting fact was 40% estimate that they would take about 2 weeks or more wasted time to deal with the problem. You know, oh, I'll do it tomorrow. Today's not a good day, or let me sleep on it. I don't know how I'm going to deal with it. And the result of that from an ability to not be able to cost it out is the impact on morale, on employee engagement, on that retention, and the work culture impact, the ability to not maybe meet project deadlines because people are failing to address situations. So I found this one very, very interesting. Another thing was, here are the top most common and costly conversations. Prickly peers, so people who are rude, disrespectful. Ticking time bombs is what they called the next one. And this is the one where we fail to talk about the project and say, oh, you know, I think if we do this, it's going to cost us more time or money. So people will not say anything. People who are not pulling their weight, lazy and incompetent colleagues is the third most common costly conversation. Those abusive bosses, and people have had experience or know about what that means. The fifth thing is management chaos. Really not having an environment at work where people feel safe to talk about things that are of concern. Those four examples. And having that inability to say something really does not help the leadership. So they classified management chaos as the fifth reason. So wow, that's a lot of statistics, and think of what it means is that how many of us feel comfortable stepping up to the plate and saying, I need to deal with this, I should deal with this, I want to deal with this. How many people will say, I want to deal with this, I want to deal with these tough decisions? I'm sure not many of us will do that, but I'm challenging you today. Do you have the courage to be brave, to address difficult conversations when they come? So here's my tips and strategies after setting the stage for you and saying, okay, here are the difficult conversations, this is why, but we need to do something about it. And of course, a lot of people will have, you know, kind of something, a pit of angst in their stomach, or their heart will be palpitating, or they can't sleep. But I'm going to give you 5 tips and strategies to start those difficult conversations. And the more you have them, the easier it's going to be. So here's tip number 1. Start from a place of neutrality. So what does that mean? Start from a place of neutrality. What that means is when you ask the question, when you start the conversation, be open-minded. Do not make assumptions. Oh, that person's late because they don't care about work, or that person doesn't pull their weight because they're lazy and they just want a paycheck. Start from a place of neutrality. Ask that question in a way that's more open-ended. So the timeliness one. So I've noticed that the last 3 weeks that you've been late several times. Can you share with me why that's happening? Very neutral, no subjectivity to it. You know, the person that's not pulling their weight, I noticed that you've not been doing A, B, and C factually. The expectation is that this happens. Can we talk about this? Share with me your perspective on this. So again, come from a place of neutrality. That allows the discussion to start. And guaranteed that will help you to start those difficult conversations. The second most important thing is to listen. And then allow them to share what they're thinking. Keep yourself open-minded as you're hearing the information, and then listen some more. And again, listen some more. Sometimes a conversation that started is about somebody just wanting to express their thoughts or their feelings, and they want to ventilate. They don't need problem solutions. And I know a lot of people sometimes think they have to help by validating emotions or by providing solutions. Don't start that. Just that can come later, but allow yourself to listen, allow them to express their concerns. And sometimes that's all they want. That's all they need. They don't need solutions. They just want to be heard, and then validate that. Work towards resolving the situation. Try to make it a mutual rather than I want you to do this. What are we going to do about that? This can't, continue. Sometimes if it's empathetic, it's how can I help? So depending on the situation, but work towards resolution together to come up with a solution that works together. When you're coming up with solutions or somebody's asking you something, do not be afraid to say you don't know the answer. So many managers do not necessarily know the policies and procedures related to the conversation that's came up, or they don't know the legislation of the jurisdiction, whether it's provincial or it's the state, and within those there are bylaws and sub-provincial municipalities. So there are many regulations you may not be aware of. So never come up with an answer that doesn't allow you to speak an untruth. And so don't be afraid to say, I'm not sure about that, but let me get that answer. Share what you can and what you feel you're going to be able to support them with, but never give them an answer that you're going to have to say, you know how I told you could have that leave of absence? Well, I'm sorry, the policy won't allow that. That means you have just broken a trust. So that's point number 4. The last one is make sure that anything you have talked about and needs follow-up, that you do follow up in a timely manner. These 5 steps will help you strengthen respectful relationships. And then the next time you have that difficult conversation, it may come from a starting point of trust and respect, and the conversation will even go more smoothly as you have these difficult conversations. So what positive outcomes have you experienced from a workplace conflict? This is, again, a different survey that I found. And what the survey found was that people will I'm sorry, I have to find my notes because part of the screen blocks the actual numbers. People have a better understanding of others, 33%. This study was actually done nationally, internationally. So they had statistics from Belgium and Germany and Australia and Canada, well, not Canada, the US. And then the second one was improving work relationships. 21% said it improved work relationships, and my recipe will improve those statistics and give you that confidence. Better solutions to problems and challenges, 9%. 18% thought there was higher performance of the team, 24 increased motivation. And the major innovation and ideas, 29%, came from having these difficult conversations. Surprising, 41% of people said no benefit, no positive aspect to having any discussion on workplace conflict. What they found when they broke it down by countries, those countries, Germany and the UK, I believe, or the United States, said where people received training on how to deal with difficult conversations, they reported less no benefit. Those countries that had no training whatsoever said, yeah, because probably they were experiencing a lot of angst after a workplace conversation. I'm going to briefly highlight the next 2 points and then move on to our case studies because I want to make sure we have sufficient time for the case studies. I mentioned that I was the creator of a concept called Connect with Rev Up. And Rev Up is an acronym and has a catchy phrase like Rev Up Your Company. It's an acronym based on the experiences that I have felt all my life in approaching people, and my husband and I, when we built our company, when I reflect back on it, we use this concept of Rev Up. We just didn't have time to call it something back in those days. And so what Rev Up stands for is respect. With respect, you build trust. Equality. Equality means having an open, honest communication where you feel equal to somebody else. And I think today, COVID really helps us understand equality. Imagine now essential workers are frontline workers in healthcare, and even at the grocery store, the pharmacy, are people that are delivering. These people now are valued so much that in Canada, we have recognized they're not paid enough, and we're giving a top up to $22,500. That is recognizing equality. So when we had iTrans, we actually treated every role as equal and important to the success of the company and team. V stands for valued. And what I mean by that is valuing others. And when you do that, you gain their trust, you gain their engagement. U stands for unique. Look for the uniqueness in individuals. Too many times we do performance evaluations and we focus on, oh, well, you're kind of weak in this area, so I'm going to send you to Toastmasters to learn how to improve your speaking skills. Well, maybe that's not what they need in that role. Maybe you need to know where their strengths are and really tap into that and allow that to flourish and nurture that. And when you do that, then looking at that potential and tapping into it. So Rev Up stands for respect, equality, valued, uniqueness, and potential. And when you adopt a Rev Up philosophy, then you give that opportunity to develop trust, strong relationships, which will have benefits to the organization and to you if you're a manager. Imagine if you had that with your staff. So the benefits of mastering difficult conversations is a strategy that will help you in your day-to-day working life, whether you're a business owner or an HR decision maker or a manager. So my summary tips to you before we get into the case studies is be brave to confront, because as you start to have more and more difficult conversations, they become more and more comfortable. Maybe those butterflies will still be there, but maybe they'll fly in formation. And when you are brave to confront, then you can improve employee engagement, create a positive, respectful work culture, and really improve productivity. keep that open mind. Remember, listen and listen some more. And by keeping that open mind, then you will, based on those statistics, save money. Imagine that $7,500, a conversation that you don't have. You'll improve the budget and timelines. People will be able to openly talk about things that will help improve the product that you deliver or the budget. And then think about Connect with Rev Up, a simple acronym for a culture, a way of thinking that really will help you master difficult conversations, because you'll create trusting relationships and have enhanced employee engagement. So I want to get into difficult conversation case studies. So I want to open it up now for the conversation. Here's the situation. Back in March 17th, in Ontario, we closed the doors. We declared a state of emergency, and those companies that were not essential to the operations had to close their doors. Many of them chose to work remotely. Many of them had to lay off people. I was talking to one person in the hospitality industry, and they had 1,500 employees. They laid off 1,000 of those employees. They closed, they had 165 locations. They closed 110. She issued 1,000 ROEs. So these, for those of you who are not in Canada, these are the equivalent of letting people know I'm unemployed and I need to get benefits from the government. So this particular case study we'll use as an example. Somebody's in the service industry and they are a non-essential service. So they had 15 people, and on March 17th, then they decided to close their doors and to lay off people. They spoke with each of their staff members, but they didn't issue letters for the staff, which is something you should have done if you hadn't, if you had not did it. If you did not do it. And I think these are some of the things that business owners don't realize, is that there are certain things that you're expected to do. Those of us who are in the human resources business understand the expectations in our jurisdictions that we support, and we know what you need to do and what you should do. On April 13th, though, the government decided to have wage subsidies and top up 75% of salaries, and the companies would then pay for the additional 25. That got people thinking, and they got this particular example owner thinking about having the staff return to work. She also realized, yes, I have to be aware of social distancing. I have to be aware of what I will do for my clients. The same scenario now is happening for our provinces as we continue to open up. People will be called back to work. So you speak with each of your staff. What are the possible responses? So I'd like to have people unmute themselves and share. What are some of the possible responses that you might have?
I'm Swati here, so I'll just, what my thinking is that obviously, as you mentioned, a letter wasn't provided. So it depends on what kind of information was given to the employees who were laid off. Like, were they told that the layoff was not because of performance? Layoffs are never because of a personal performance of an employee. It's not supposed to be. So, or were they provided enough details and clarity in communication? Because when you go back in, you've kind of lost the trust of the employees. So it's very hard to, if an employee has been working for you for a decade, and all of a sudden you just lay them off without a formal letter, and then you're asking them to come back. So it's, I guess that is an important part of the response, that the employee, how they are thinking, how the employees who are laid off, what they're thinking. And so the empathy part, I think, has to be a little high. I hope I'm going in the right direction.
Other thoughts? Thank you for sharing.
Hi, this is Diane. I think that you could get a variety of different responses. You might have some people who are just so eager to come back that they're saying, yes, absolutely, I'm in. But then you might have some that are upset that the company isn't topping up the 75% and may feel that that's not enough. And even if it is above the CERB rate that everybody's getting.
Mm-hmm. Yes, great response. Yes, any others? Thoughts? Okay. To answer Swati's question is that in this case, these layoffs would have been due to the COVID, and the manager would have everybody understood that why they were being laid off. It was not performance, as you say. The added twist in Ontario is that if you have an agreement, your agreement should have inside the agreement layoff conditions, and probably 90% of organizations did not put that in. I remember talking to one of my lawyer colleagues, and he said, yeah, Hilda, we would state this in every, we would state this to our clients, and they say, no, we'll never be in a layoff situation. So some people actually put the layoff provision in, but others didn't. And the difficulty of not putting that in, and as you said, 90+% of employer agreements don't have that, is that it then can be considered what we call a constructive dismissal. It's what that means is it's like you tried to get rid of me and you tried to terminate me even though you didn't terminate me. So I'm going to turn around and file a claim that says you've constructively dismissed me. So here's some other possibilities that could happen. As Diane mentioned, yeah, some people will be happy. I can't stay at home anymore. I need to go back to work. Some will want to stay at home with their families because they have school-age kids. And then some want to stay on CERB. As Diane mentioned, it's not worth it. So for those of you who are not in Canada, CERB is a top-up for Canadians that basically gives them $1,000 a week for being not able to work for a variety of reasons, and it's a support for everybody. So some companies, and this one happened in this particular case situation, is that some people were afraid that they were only going to work part-time anyways, and that amount did not seem worth it, because if I come back and I work and you only give me $250, then I could have stayed at home and not worked and got more money on CERB, so it wasn't worth it. Another scenario is people will refuse, citing unsafe to work situations. And in Ontario, you can actually cite that, and then it would result in the Minister of Labor having to come in and determine whether the place is unsafe. A lot of people are talking about unsafe situations because maybe from a physical point of view, they're afraid that they'll get COVID-19 because the conditions were unsafe. So those are the 4 different scenarios that we can talk about. We've got, again, another 9 or 10 minutes. So I think the most difficult one might be the one where somebody is having to say, I don't want to come back to work, and it's not worth it financially. Does somebody want to start the ball rolling on case number 3 then? How would you approach it? What would that be opening line be? I think everybody should just unmute themselves. So if they want to say something, they say something. If you just want to listen, you can just listen, because then we can have this kind of ongoing dialogue.
Hi, Hilda. It's Violet. So I was actually just laid off last Thursday, and it was a contract that I had hoped would turn into something permanent. They obviously don't have a crystal ball, so they can't tell me whether or not I'll be coming back. Although there was kind of an insinuation that if the funds were there, that I would be welcome back. So I've been job hunting, and what you were just sharing about people not it not being worth it to come back for less than what serve is, I was offered a 6 month contract working part-time 2.5 days a week. And I said, I'm really looking for something that's full-time, and is there another department that I could also support as HR coordination and recruitment? And lo and behold, just by asking that question, somebody else said, oh yeah, I actually do need some extra support during this crisis because we're pretty overwhelmed. It's a senior service, so they are on the front lines supporting seniors and the vulnerable. And so I'm hoping to get a contract offer today, but it's just about, from a job searching perspective, I suppose I can just offer that as some insight. So.
Yeah, thank you. Thank you.
Thank you.
I see people put, Diane's unmuted herself. You can, oh, I understand there's background noise, but feel free to unmute and mute. Diane.
I think with the CERB, my understanding, and if anybody else has some input into this, my understanding though is if you recall an employee and the employee refuses for reasons other than directly COVID related, like health concerns, for example, or childcare concerns, my understanding is that the employee would no longer be eligible for CERB.
You're absolutely correct on that. But it's tricky. Okay, so there's yes and no. If you recall people back to work and they do not want to come back, this is the difficult conversation that you would have to have, because, and this is where you have to understand exactly what the implications are. So if you were the business owner and you didn't understand everything, you'd say, I'd have to get back to you on that, but I need to figure out what the implications are from CERB perspective, right? Because a person doesn't necessarily know. So here's what happens when you don't know the answer and you should say, I need to get back to you. So as Diane says, I think if you refuse, then you're not eligible for CERB. And that is correct. If you are recalled back to work and you don't state, it's like, I have a health condition which exposes me to, if I get COVID, it's gonna be a problem. So people, for example, with a respiratory underlying condition, or maybe different things like a heart condition or other problems, they can cite that they are vulnerable and not return to work. People who are in a family situation or have elderly that they're supporting say, I need to be at home to do, and I can work remotely, but I can't come back to work. So they in our province of Ontario, they actually supported that you cannot be terminated as a result of COVID-19, a reason which is outlined, because it's protected under the Employment Standards Act. So here's the kicker though. If you say you're healthy, we expect you to come back to work. If you don't want to come back to work, then we will terminate you. And if you're terminated and it's not COVID related, you will not be eligible for CERB. So as I mentioned, in Ontario, we have that agreement letter that says, if you put it in as a layoff, you're fine, you're protected. But if you have no layoff provision in your agreement, then you could be the employee can presume that they have been constructively dismissed and file a claim. So here you are, you're terminating somebody who also has a claim on you that you constructively terminated them. So this situation is not black and white, right? So the difficult conversation is, how do you respond and keep the lines of communication open, keeping that respect? If you force them to come back to work, then what happens? When we return to our new norm, are they the ones that go say, that's it, as soon as things are good and I can find another job, I'm going to go somewhere else because this company sucks and they don't care about you as a person? So you do tread on difficult waters with that. Any thoughts on that, Diane, or others?
Well, instead of treating it like a termination, here's another thought is
Sure.
if we recall employees, excuse me, and like I said before, some are going to be eager, great, can't wait, I'm in. And then there's going to be some that are going to hesitate. So I would have a one-on-one with the people who are hesitant and just say, how can I help alleviate your concerns? What is your hesitation about? And then, and like, it might be that they're afraid to come into the workplace. Well, that's okay. You can work from home, that sort of thing.
Yep. Yep.
But if we're able to accommodate the employee to work from home, we're recalling the employee at the 75% wage subsidy, which has them earning more than CERB.
Right.
And the
Well,
employee
hopefully.
refuses for no COVID related reasons, just chooses not to. Can we at that point consider that to be a resignation?
You could ask for their resignation for sure. But
Even though we're not offering to pay their full salary.
yes, but I think in the 75% wage subsidy, the expectation is that the company should be paying the additional 25%, at least to the equivalent of the COVID, at least to the extent of the wage subsidy, which would be $1,175 or $1,125. So whatever the difference between 847 and that maximum.
But if the company can't afford to top up the wage subsidy,
Yeah.
I mean, that it was a recommendation, it wasn't a requirement.
Exactly. But there is an expectation that the company should try to. So if
Should
they
try
find
to,
out,
yes.
yeah, they find out that the company had a profit and made lots of money, and they didn't top up the staff, that they would not take kindly to that. Because here I gave you 75% and you didn't even give people 25%, yet you could afford it. That's where the reckoning will come.
Yeah.
Right. It's not an automatic that you say, hey, I don't have to pay you the 25. But if it's a difference between you don't have a company to come back to, or you do have a company to come back to, yes, that would be a reason for sure. You can see how there's so much complexity in these, and yes, you need that one-on-one difficult conversation. You need to keep that lines of communication open and be respectful and try to accommodate, because it's the goodwill that you create now. This is the opportunity to build trusting relationships for the future, for sure, for sure. Great. We had a great discussion on this. I want to just wrap up. I'm respectful of people's time. I know it's just 10:45. One of the things that we can do, one thing we realize is that all of a sudden business owners, particularly ones that don't have human resources expertise in-house, really are trying to learn how to be HR experts, and they don't know how to anticipate some of the things that people have shared with us, like Diane and Violet and Swathi. So what we've decided to offer is a package of what I'll call 2 hours of on-call retainer services. It's 2 hours taken over a period of time, whether it's 5 calls, 1 call, and we're doing it half of our normal price. So for the period of 6 weeks, you have this on-call 2 hours to use myself or my People Bright team, and only cost $300. It will include a free 30-minute one-on-one strategy call with me. The first 10 people who register will actually get my HR self-assessment audit. So you know all the things you should be doing and where you're at with your company on those different aspects. So I encourage you to think about it. If you're trying to figure out what you should do, whether it's a difficult conversation or what's going to happen when people return to work, do think about considering our HR on-call retainer services. We've been offering this bi-weekly, and our upcoming session is on finance focus. And Tracy Bissett, who is the owner of Bissett Financial Fitness and a regular podcaster offering Young Money Fitness, is going to be my guest next Wednesday on Cash Control, Know Your Numbers and Grow the Future. And then on Friday next week, I'm going to talk about, are you ready to reopen your business? All the things that you should be considering from an employee point of view, like the tough decision case study we had today, to the safety features that you should be considering, because I think a lot of business owners may not think of all the things that they need to consider. One of my clients was talking on the phone to me, and she did a great job of some factors, but I had to fill her in on other things that she hadn't quite thought about. Our upcoming ones after that, the following week, is Aviva Abraham will talk about group benefits and disability and what the impacts and what you should know about that during COVID times. And then on Friday, May 15th, I'm going to talk about business continuity plans and the fact that people should have them in place and what they need to include. So are there any other questions for today before we finish our webinar? Jenny, any questions that came through the chat line, or anybody want to open up and have a last question for me?
None on the group chat. If
Okay.
anyone wants to unmute themselves, like Hilda said, feel free to do so.
And my contact information is here. You will get a copy of these slides and a link to the presentation that we save on YouTube. Well, I would like to thank you all. I hope that the strategies will help you gain confidence to tackle those difficult conversations that come at least once a month, according to statistics. And for some of you, say it might be even more than that. So be safe and have a great weekend. Thanks for joining us today. Bye. Thank you, Violet, for that lovely comment.
And thank you, Swati, for joining us from all the way in the US.
Yes, I really liked, so Swati actually joined us from the United States West Coast, so it's very early in the morning, so thank you for sharing your insights. I loved our conversation at the beginning of the session.
No, thank you again for your time and giving me the opportunity. This is a nice small group, so it was nice. Thanks again. And, have a great,
and thank you, Rachel, as well from Israel. Have a good day.
Oh my God, Rachel, okay, come on live for a second and talk to us. Even if you're American, you're an expat. My husband almost went to Israel, but he realized he had to. He realized he had to be in quarantine for the 2 weeks when he wasn't going to stay there that long, so he canceled his trip. We almost got there. Talk to us.
Here, I'm on LinkedIn. My ex-husband brought me over here. So long story short, divorce, staying in Israel.
Oh.
And it's like hot today, so.
And how is it there for COVID? How are you guys managing?
Going back to work on Sunday.
Really, really. Wow.
The precautions with a mask and stuff like that, but yeah.
Yeah. So is it? Are people feeling okay with the idea of returning to work, or a little?
I think so. I think so. We'll see on Sunday, but like shops are open, not the mall, but there's making sure that everyone comes in with mask, and there's police outside making sure that people are. The store's only allowing people like a store like the Mega Sport. They only allowed a specific people amount in the store. They would close the door, and the police are looking, and they'll close down the store if they're not following protocol. Grade 3 is preschool to grade 3 are supposed to go back to school on Tuesday. Special ed already went back to school.
Wow.
And the 3 and above are going back to on the 10th.
That's interesting, because I know in Ontario they've been talking about they're going to, once they open up, they're going to allow children up into high school age to go back to school. And they say, well, why would you not allow the high school people, because they're trying to get into higher education university, to open up first? Because young kids can just, you know, touch each other and spread germs.
Yeah,
So this is,
right?
yeah, I'm interested because you're validating the logic of our Ontario people. So I don't understand the logic myself, but there must be some reason they think it's okay.
I told my boss, I'm like, okay, wait. Up until grade 3 are going back to school on Tuesday, but you want Sunday's a working day and Friday isn't, and you want us to go back to work what are you supposed to do with the kids?
Yeah, yeah.
But 2 of mine are in dormitory, so that makes it a little bit easier.
Yeah, for those of people who don't understand, Sunday is considered a work day. Friday, Saturday is your Sabbath, is your rest days, right? Some people
Rest
say,
days,
why
whoever
Sunday?
observes it.
Yeah, your religious observance days.
Yeah. Well, we work on Sunday, so I missed that.
Yeah. Okay, well, stay safe and thank you for joining us. I think you've joined us a couple of times. I think I've seen
think
your name
so.
once. Yeah.
Maybe.
Yes, I think I've seen your name at least one other time. So thank you for joining us all the way from Israel, because I think as we learn about different countries' perspectives and what they've done, it really helps all of us figure out how we go through this together, because we are, as a world, all in this together. It's a very difficult time for sure.
It was important for me about the communication because the culture here is different and people understand you differently, and it's important for me to not have have someone understand me differently, and it's to
That's true.
communicate
Being an
correctly.
American in Israel, there's that
Yeah,
having to understand and be open to
I'm Canadian American. I was actually born
Oh.
in Vancouver.
Oh,
So
my mother was born there too.
wow, I heard I haven't been there since I was 3, but you have to get along.
Yeah.
Get along and communicate, and that's why I also took many courses, so I understand that I'm not alone, and if I'll need to, I'll have to do a job change.
Well, stay safe and thank you again for joining us. Thanks everybody. I think it's been
Amazing.
a great conversation, and I really do hope that these tips will help you as you go forward, because some days
Nice to speak
these
in my native tongue.
difficult
Yes.
conversations are, oh. Okay, stay safe everybody.
Thank you.
Thank you.
Bye.
Bye.
Thank you.